Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alameen. Wassalatu wassalamu ala Rasulihil Kareem wa ala alihi tayyibin at-tahirin al-ma'sumin. Amma ba'd. Assalamu alaikum. As has been told that the chronic pain is a long-term pain, but it's a big struggle in the medical community about the chronic pain, because the mechanism of pain is so diverse and so complicated that the people are not able to understand why the pain lasts that long when the original injury has ceased to exist. Now, if you see that the most severe form of injury, when somebody can push a knife into it or cut your hand off, or you are crushed in a car, or a bullet goes through your arm, or you had an operation, abdominal operation or a heart operation, your chest is split up and it's even again, the pain that is acute pain of injury to the body goes away after a week or so. It doesn't last long. So our body is designed to give, when there is acute injury to the body, the pain is a signal that there is an injury, and then the intensity of the pain slowly goes down, and everything heals up and the pain goes down. But the chronic pain is different. It can start without any obvious cause or a trivial thing. I just bent to pick up a towel and my back went and then never got it back to right. Or my neck or my shoulder and things, and that does not improve at all. And that lingers on and on and on and on. And the medical science has failed to come to a conclusion what causes pain. But now the understanding is that something happens in our nervous system. The nervous system that controls all parts of our body, especially our muscles, that something has gone wrong. Normally, we have got a small tone in our muscles, which maintains our strength and our body position all the time. And the tone changes as we use our voluntary muscles. But then the muscles go into severe spasm. They lock you up. They don't allow you to move, and any movement causes severe pain. And what has gone wrong, what has contributed to it, means that there is something going into the electronic circuitry within the spinal cord, where the information is sent again and again and again and again, saying there is something wrong there. And the motor part of your body is trying to protect that part by keeping the muscles tight and not allowing it to move. And that has led to what has gone wrong. So the most common, I will just give a brief introduction. As I said, as the sister was explaining about allergy, that the 5 years knowledge, the understanding of pain started in 1973 or 74 around, when one of the anesthesiologists in USA, Dr. John Bonica, started to treat his wife because she used to be in pain. And he decided, because the anesthesiologists have got a special interest in pain, and they they understand pain better than other doctors. So he started the first institute of study of pain in America, which has grown up and has become a world body. It has got different chapters, and there is a UK Pain Society. The British Pain Society is a chapter of the International Study of Pain. Alhamdulillah, I am a member of the British Pain Society. And I will give you, once the slides are turned on, I will give you just a brief introduction about the number of the people who are in pain. Now, according to the British Pain Society, there are about 14 million people in UK suffering from chronic pain. It's a long-term pain. They keep taking medications, they go for physiotherapy, they take different types of treatment, chiropractor, osteopathic, reflexology, and the pain still lingers on. And then there are acute exacerbations when the pain is very bad, and then it can be cured for some time, and then it lingers on. So there are a lot of studies going on from different directions, but there was a man. His name is Dr. Chan Gun in Canada. He's a Chinese doctor, and he tried to understand the basic mechanism that what we are seeing. How can we differentiate a condition by just simple examination? In early 80s, he came to UK and he provided a course in Cambridge, and I happened to go there and attend his course, and I observed him practicing, and I saw the results, and it was really amazing how very simple techniques can improve the pain. Now, Dr. Chan Gun lives in Vancouver, Canada. He established a study of pain again by the side like the American one. And his knowledge of acupuncture, because he knew that the Chinese use acupuncture to treat lots of things, and he was trying to understand how putting a simple needle causes a pain relief when the medications have failed to do that. And so he came up with an idea which is called the intramuscular stimulation. Now he established an institute in Canada, and he tried to teach all over the world. His technique is taught in America, in Washington, D.C. He is an honorary professor, and his technique is taught now in America. In Canada, the University of West, one of the university has started teaching his courses, and he has donated $5 million, so keep his technique known to everybody. But unfortunately, this man, who should have been given a Nobel Prize for finding such a unique way of treating the chronic pain, which is so difficult to treat, but his name never came up in the medical circles. I'm sorry to say that even being a professor emeritus at the Washington Pain Clinic, even the British Pain Society does not know his name. And it's unfortunate because he is not a white man. I think this is the main reason. He is not a white man, otherwise he would have earned the Nobel Prize. I learned his technique from him. I learned him and I used it, and I found it very, very effective. And I teach this technique to everybody. I go to Iraq, alhamdulillah, many, many times. I've been there for many years, and I have trained some of the Iraqi doctors. So in Karbala and Najaf, they are using this technique, and alhamdulillah, it is working. I have established a pain relief center in UK, which is in Ashford, that you have got this leaflet. And inshallah, I will be treating the patients who have gone all over and come back. Last July, I was in Iran, and we had an American doctor who was talking about chronic pain, and he gave a lecture about how difficult it is to manage, and how serious is the problem, and how the people get addicted to opioids and things like that. And after him was my lecture. And I said that there is still hope, and because there is a simple technique, and I will give a practical demonstrations. So I gave the demonstration on some of the patients, and you will see that this technique works fast, like an IV opioid injection, and you can see the relief coming. It doesn't. There is nothing 100%. Not every patient will get the benefit, but more than 50% of the patients can be benefited from a simple technique called intramuscular stimulation. There are some practitioners. In UK who do practice intramuscular stimulations, but there are very, very few of them. Is it working? Yep. Okay. Now, so you can see a slide. This is the one which shows how many people in the UK are suffering from chronic pain, and this is a website called the Pain UK. If you see this one, then you can see much more detail. Can we go to the next one? Yes, please. Right. See in America, the richest and the strongest country in the world, chronic untreated pain affects 116 million Americans. Pain is everywhere. And I have been to America a few times, and I have treated many patients there. And but now I don't do it because of the fear of litigation. I say thank you very much. If you want the treatment, come to UK. I'll do it for you, but not in America. So this is something. But you see the number of the people who needs treatment. One of my friend who had a car accident and he had in back pain and leg pain. He's a doctor himself in Atlanta, and he had pain for 2 years. And for him, I went there and I did my intramuscular stimulation, and Alhamdulillah, he improved. Now, this is another slide from American Pain Society, which shows what is the they need research in this field. They need why there are so many Americans in pain, and why the pharmaceutical companies are making billions of dollars by selling the medications, and they don't want something very simple that you stick a needle and your pain goes away. Who will buy the medications then? You don't need to. So we can go ahead to the next one. So why there are so many people in pain? So because the understanding, there is a minimal training about the pain management in the medical colleges. In UK, in all the medical schools, now this is about the America and Canada. You can see that pain education programs at 117 US and Canadian medical schools found that most devoted less than 5 curriculum hours to pain topics. So in 5 years, if you only got 5 hours to understand pain, how much knowledge they have got. Same thing is in British universities, from 3.5 hours to maximum 13 hours in 5 years. And the same is the problem in the European universities. So this is the problem, and the people are really afraid of what to do, how to treat pain. So they will refer. The UK practice is that when the GPs cannot do anything, they will refer him to an orthopedic surgeon, and he will refer them to a rheumatologist, back to a spinal surgeon, and this goes on and on. I have seen years and years similar things. Many people end up with operations. And this is a big problem. There was a fashion when in the British hospitals, they are doing back operations all the time, and then now it is stopped. Very, very few operations anymore, because the back operation does not guarantee that your pain will go away and you will be cured. On the contrary, the pain can become worse, and you can end up on a wheelchair. You can't be functioning anymore. And there are lots of patients who have got the failed back surgery syndrome, and it is very difficult. Now all the gadgets that are being used, where you can insert a spinal cord stimulator into the spinal cord, and then you have a brain operation and put the implants in it, very, very expensive. Very, very expensive, and no guarantee that it will cure the pain. So my advice will be that like anywhere else, in our community, our own community, there are lots of people are suffering from chronic pain, and they have been to their GPs, and they have been to taking the pain medications all the time. So my advice will be that there is a simple technique. These all slides are about showing the enormity of the chronic pain, and how the chief medical officer was saying that we have got less training and we have to do something about it. But now when you go to a clinic, a pain clinic, there is a long waiting time. To see a pain specialist is a big thing, and then after that, to have a pain treatment is another problem. And then to have a repeat treatment is another problem. So the problem is continuous. So Alhamdulillah, I have this is Chan gun. This is a man, is a Chinese. As I said, if he was a white man, he will have the Nobel Prize, but he did not get it. It is his book, Treatment of Chronic Pain. He has mentioned how he found the technique and how useful it is. And so I give to the doctors and say, you please read it, and I will do the practical training so you can learn it, and then you can practice it, and it can work. So more than 50% of the patients, that is advice is that more than 50% of the patients can get better. And it is a treatment. It is definitely a treatment, and not just like if you take a medication, it masks the pain for a while. It does not cure it, but you feel less pain for a certain time, and then the pain comes back, and you take more and more, and your body gets used to the medication. So you have to keep on increasing the doses, and you have to suffer from the side effects. We can go to the next one. So there are some common chronic pain syndromes like back pain and sciatica, neck and shoulder pain, headaches, myofascial pain syndromes, post-operative pain, failed back surgery pain, whiplash injury pain, reflex sympathetic dystrophy pain, trigeminal neuralgia, post-herpetic neuralgia, phantom limb pain, etc., etc. There are varieties of pain, and some of them are very bad. If you see them and you say, my God, how the people are living, it's like living in hell. So that can be like thing. So chronic pain can occur if any of the following are present. Either there is an ongoing nociception or inflammation, like the chronic arthritis, which can cause pain. Sometimes psychological factors such as somatization disorder, depression, functional and structural alteration within the central, peripheral or autonomic nervous system. What causes the problem in the nerves? It is called the spondylosis, and this is the theory from Changan, that actually the use of the two parts of our spine, the neck and the back, are the most mobile, and when we are moving and doing things, there is a minor trauma to the nerves all the time. When it reaches a threshold, the nerves become super sensitive and will behave erratically. Okay, can we go ahead? And this is another diagram which shows that what happens to the muscles. Shortened muscle syndrome. The muscles around the spine, they go into spasm, and they lock you up, and they cause tremendous pressure on the discs. The discs, these are like cushion between the vertebrae, and they prolapse because of this spasm and increase in the pressure, and they can press on the nerves themselves. So you can see this is another slide showing the people in spasm. Okay, go ahead. So the intramuscular stimulation is a technique from the traditional Chinese acupuncture, but it updates and enhances it with anatomy and neurophysiology. We can go ahead. It is simple to learn for doctors, nurses and therapists who have training in anatomy, and results are predictable and superior to acupuncture because treatment is based on physical science. So he tried to introduce to the universities, but actually nobody has picked it up. It is more effective than any other physical therapy. Knowledge of IMS can provide an excellent bridge between Eastern and Western medicine. Okay, again this is Changan. I think we can stop it here. So what I will say that this is a technique. I will be very happy to give treatment to anybody who has been suffering from chronic pain, and you got my number there. Contact me. It's a free consultation, and I can advise about the treatment. Thank you very much. Allahumma salli ala Muhammad wa ali Muhammad. If there are any questions, I will be happy to take the questions. Assalamu alaikum. I think it was a good conference. It deals with the health problems that the community faces and that most of the people don't know about. And before me was a lecture about the allergy, and my lecture was about chronic pain management. Chronic pain is a global problem, a lot of people all over the world suffer from long-term pain, and this pain cannot be treated by medications. And they keep suffering and taking medications continuously and get addicted to it and suffer side effects. So I talked about a new method which is very simple, very easy. It's called intramuscular stimulation. It uses acupuncture needles, but it is not dependent on the theory of acupuncture. So anybody who understands anatomy and physiology, especially doctors and paramedics who do understand, can learn this technique and treat most of the patients who suffer from chronic pain. Thank you very much.